Story 1. When someone spiked my drink, at first I just became extremely drunk. Then I lost the ability to form words. I tried talking, but nobody could understand me. I don't remember it clearly, but I must have decided to walk home. Suddenly, I found myself in an alley. My muscles stopped working and I collapsed to the ground in the middle of the night. I wasn't able to move or speak at this point. My vision became completely blurred, and I remember feeling like I was sinking into the dark, unable to fight it. Everyone around me seemed very far away and strangely tall. Toward the end, I had tunnel vision and couldn't stop vomiting. I struggled so much to stay conscious. It was terrifying. Thankfully, some children noticed me. They walked with me, managed to unlock my phone, and called my family. They stayed with me through the entire ordeal and literally saved my life. When I recovered, I found them and they told me they initially thought I was just really intoxicated. But then they saw a man following me from a distance. That's when they realized I might be in danger. To this day, I still feel like crying when I think about what could have happened and how terrifying it was. The worst part? 3 days later, I checked my phone and found several clear notes I had typed saying, "I think someone put something in my drink." I wasn't able to talk, but I could still think and type clearly. I remember trying to show it to the bartenders, who didn't help me. That still enrages me. I didn't expect this many people to respond to this. I'm so sorry this has happened to so many of you. It's a horrible experience. Hugs to everyone who had to go through something similar or worse. Also, a big shout out to the one person who tried to point out that you can't die from a spiked drink. That certainly makes everyone's experience seem less of a traumatic event. Story 2. Got dysentery while backpacking in India. I was camping at a meditation retreat at the time, and my camp was just a little bit away from the main area, about 100 meters, not actually far, but on the other side of a bamboo grove. No one thought to come looking for me until I had not shown up at breakfast for 3 days. By that point, I was fully unconscious, had soiled myself severely, and was too weak to lift my head enough to sip water. Someone had robbed me while I was unconscious and thankfully thrown my passport into a bush, but left me with no money at all and no credit card or anything. It was very bad. Amazingly, all of my friends were suddenly very busy elsewhere. Some backpacker from England, whom I had not met before, stepped up, made a stretcher, and carried me out to the nearest place, a farmhouse about 2 kilometers away. The farmer took me in, and his wife nursed me back to health over a couple of weeks. They were incredibly poor people, living in a mud hut with a cow dung floor. But they fed me fresh warm milk directly from their buffalo every morning and brought me turmeric and cumin broths and traditional herbal medicine. As I slowly got better, I connected a lot with the wife. She taught me how to make chapati on a clay oven and how to make a really good dal. I learned some Hindi as well. When I was finally well enough to leave, still quite sick and weak, but eager to get to civilization, cancel my credit card and see a proper doctor, I profusely thanked them both. I neatly folded up the hand-spun wool blanket the farmer had given me to use. My sleeping bag was in a truly revolting state and had needed to be incinerated. But when I tried to give the man back the blanket, he flatly refused, insisting that I keep it. I couldn't accept it. I might have been in a very poor circumstance and had zero money at the time, but I still had my passport and home to go back to, and these people were poor. I couldn't take their blanket, especially after all they had done for me. We went back and forth for a bit, struggling because he didn't speak English and my Hindi was only a handful of phrases at that point. Finally, I handed it to him and said, "This is your blanket. I can't accept it, but thank you for everything." And he said, "You're right. It's my blanket, and I'm giving it to you." That man changed my life. In that moment, I realized I was blocking him from giving, and that was a terrible thing to do to someone who had been so incredibly kind to me. This was 25 years ago. I still have the blanket. Story 3. I had mononucleosis when I was 6 or 7 years old. I would come home and go straight to sleep. I do not remember that part. However, I had such a severe case that I was hospitalized for 2 weeks. Story 4. Complications from colon cancer surgery. The surgery was successful, but my intestines remained paralyzed and did not start working again immediately. Doctors said there was nothing they could do but wait, as the intestines would eventually resume function. I could not eat or drink anything for 2 weeks. I was put on a peripherally inserted central catheter line for total parenteral nutrition feeding to stay alive. After 2 weeks, my intestines began working. At that point, an uncontrollable, foul, putrid, rancid discharge emerged, the result of the contents festering inside me for 2 weeks. I had no control over my bowels when they resumed function, and the discharge would spread all over the hospital room. The nurses kindly cleaned me and the room repeatedly, but within minutes the area would be covered again in liquid, putrid material. My anus became inflamed and infected from this condition. Although my bowels were functioning again, I still could not eat normally. Due to the risk of refeeding syndrome, I had to continue total parenteral nutrition and could only consume very small amounts of real food, despite my increased appetite. Being constantly exposed to discharge also led to an antibiotic-resistant urinary tract infection. After 3 weeks and losing 30 pounds, I was able to go home. It took a full year for me to fully recover. Story 5. Spinal cord tumor. Waiting to hear what grade it was. Luckily, it was grade 2, but it can come back possibly as grade 3, which is cancerous. It has been almost 10 years now, and twice-yearly magnetic resonance imaging scans show it is still gone. Gear is hoping it stays that way. Story 6. Stage 3 lymphoma diagnosis at age 29. Responded to treatment but keeps coming back. I have had 5 relapses, for a total of 6 treatments, one of which number 4 was a bone marrow and stem cell transplant. During the bone marrow transplant, I developed pneumonia. I reached a point where I had no energy left to give and did not know if I even wanted to survive anymore. But here I am. Next computed tomography scan and doctor visit are next week. Story 7. I was 16 and got toxic shock syndrome from tampon use. When they tell you not to leave it in too long, they are not kidding. I had such high fevers that I remember hallucinating while watching Freddy vs. Jason. I thought I could see the gears in my brain working and ticking away while talking to Freddy Krueger. Then the diarrhea started, and it was like water every 10 minutes. I soiled the bed. I remember being delirious on the ground, watching the sheets being stripped while I continued leaking my bowels. I stood up, and it continued to pour out of me. I had absolutely no control. Then I started vomiting, all while having a sore throat that felt like razor blades every time I swallowed or threw up. I slept a lot when I was not soiling myself. After all that, my entire body developed a red rash, and my skin peeled all over, especially on my hands and feet. It was like layers of dead skin coming off me. That was the worst week of my life. I have had COVID-19, the flu, chickenpox as an adult, given natural birth twice, and had an abscessed tooth. Honestly, the humiliation of not being able to control my body was the worst of it all. Story 8. About the same time last year, I had surgery to remove a polyp. It was supposed to be only an overnight stay. However, I became really ill during the night and had extreme pain in my abdominal area. The overnight nurse was so concerned that she called the surgeon at home. A whole team burst into my room to connect me to a heart monitor, oxygen, and an intravenous line that thankfully also contained morphine. The surgery resulted in a case of acute necrotizing pancreatitis and a 3-week stay in the hospital. Things were a little blurry back then, but I remember having a moment when it felt like I was dying, just floating away into peace. I remember thinking, I think I might be dying. I thought I would fight it more. I am still healing 1 year later. Story 9. The last time I detoxed from alcohol, I had been sober for about 3 months and then relapsed over a weekend. I drank about 2.5 gallons of Tito's vodka over Saturday and Sunday, and subsequently on Monday before I snapped out of it. I had some legal matters going on and was too afraid to go to the emergency room, so I asked a biker I had just met to bring me a 6-pack of beer. By Monday, I was so sick that I was already detoxing and could barely walk to the bathroom. I needed to taper down and have someone make sure I didn't die for a day. He said he would do it if I bought him some cocaine, so I gave him the cash for it and detoxed hard for a day. I experienced sweating, shaking, discomfort, cold and warm sensations simultaneously, hallucinations, and I couldn't get a TV jingle out of my head for hours. I kept dry heaving and almost lost control of my bowels. I laid on the hardwood floor because it was the only place where I could feel both cold and warmth under a blanket. I remember wondering if I was going to die. The biker said he would never do that again, and it was the scariest thing he had ever seen. However, he did clean my kitchen thoroughly afterward. I have been sober for 6 months and some change now. Story 10. It was November of last year. I was diagnosed with aggressive breast cancer in September and was receiving chemotherapy and immunotherapy. I had a plastic tube going into my right arm called a peripherally inserted central catheter. One night, I noticed the skin under the clear plastic dressing covering the catheter was a little red and itchy around the edges. Later that night, I woke myself up scratching my skin and realized the rash had spread to cover most of my body. I had to rub myself with ice packs for some relief and was sending my nurse care team pictures of my rash at 3 a.m. By the next day, I was in the hospital with grade 3 dermatitis all over my body, including the palms of my hands, soles of my feet, and inside my mouth. The rash was caused by my own immune system attacking my body because of the immunotherapy. My liver markers showed that I was also suffering from immunotherapy-induced hepatitis. I was in the hospital for several days, receiving steroids intravenously. I have never felt as ill as that, but thankfully the steroids worked. When they discharged me, I was taking 90 milligrams of prednisolone. I weighed 62 kilograms, which is a high dose. I am waiting on my pathology results from surgery. I will find out tomorrow what the next steps in treatment are. Check your chests, people. Story 11. Gave birth. When I got home, I had a feeling of impending doom. I told my husband we likely had to go to the emergency room. I checked my blood pressure and it was in stroke territory. Postpartum preeclampsia with severe features. No secondary symptoms other than high blood pressure and impending doom. Stayed in the hospital a few days until they got my blood pressure under control. Story 12. I had acute tonsillitis while working alone in the office. I had never had it before, and it hit me quickly. At the time, I did not know what was wrong with me. When I went to work, I felt a little bit rough, but a few hours later, I was lying on the floor shivering, with a high fever, sweats, and barely able to talk. I do not know how long I was lying on the floor wondering what was wrong before I found the energy to call someone to take me to the accident and emergency department. I later had to have my tonsils, adenoids, and excess soft tissues in my throat removed once the antibiotics had done their job. Story 13. In July of 2023, I woke up around midnight. Couldn't breathe. I suspected I was having a heart attack. I walked into the emergency room. My husband drove me. I barely managed to say the words heart attack. I was rushed into triage. They started taking my blood pressure and oxygen level. My oxygen level was at 80. They asked me questions. Apparently, I had a cardiac arrest at that point. The next thing I remember is hearing someone using my full first name, telling me to open my eyes and look at them. No one uses my real first name. Seriously, no one. Once I was coherent, it was explained to me what had happened. Around 6 to 7 hours had passed. I was stable enough for an angiogram. I had 2 100% blockages and 1 80% blockage. That afternoon, I had a triple bypass heart surgery. Recovery was difficult. However, I have worked hard, and my last echocardiogram shows my heart is currently at 55%, which is considered normal. I am no longer in heart failure. I had no idea. Yes, I have an extensive family history of heart disease. However, my personal history had always been good. No high blood pressure or other indicators. Slightly high cholesterol, but nothing dramatically high or enough for my doctor to put me on medication. I actually didn't take a single prescription drug prior to this. My surgeon was a pediatric cardiac surgeon because my anatomy is considered small. I am a small lady. He undoubtedly saved my life. I'm told my surgery took about 9 hours. He said he had to work very slowly and it was intricate, but that's his specialty. I was his last patient before he retired. He just happened to be in the hospital that morning and was asked to look at my case. I don't know if I would have survived had he not been there. Apparently, It was critical that the surgery be done immediately despite its risks. Thank you, Dr. T. Story 14. I had coronavirus disease. Then 6 months later, I caught respiratory syncytial virus. I never got better. I had lung issues, brain issues, and lost my taste and smell. I was sick in a way that I don't think a doctor can fix except with steroids. I slept a lot. I remember thinking I was dying. It was like a tide that pulls back sand as it recedes. Still not better, but not dying. Story 15. No one has mentioned alcohol withdrawal yet, but that would be my entire top 10. It feels like being inside a giant ringing bell, with the temperature fluctuating between hell and Antarctica. Crawling to the kitchen to try to keep down a slice of bread and a beer, spilling the beer everywhere. It is like having a seizure while conscious. Emotionally, there is intense regret because you know you did it to yourself and likely did something else regrettable on top of it all. Story 16. When I had a ruptured appendix, the pain, the surgery, and the recovery were a horrific time that required cognitive behavioral therapy. Story 17. I think the worst I have ever been was when I ended up in hospital for a week with viral meningitis. I was at school when I suddenly had a severe headache, and the lights were hurting my eyes. I had a rash all the way up both arms. I was in science class, and my teacher would not let me go to the nurse because other kids in the lesson were messing around. She told me to do my work and go after class. I could not keep my eyes open, so my head was on my desk. The science technician came in to bring Bunsen burners. She asked what was wrong, but the teacher talking overheard and said there was nothing wrong with me and that I was clearly just trying to get out of work. Once I explained to the technician about the headache and the lights, she took my temperature. Then she spotted the rash, ran to get a glass, and confirmed it did not disappear. She called emergency services while making a friend use my phone to call my mom. She told me later that after I was back at school, she reported the teacher to the head teacher. My mom made it to the school somehow before the ambulance arrived, so her car got locked in the school. Thankfully, my dad had a car. A week later, I was discharged but still had to keep an intravenous line in, and a nurse came to the house for 10 days to administer antibiotics. I panic every time my children get a rash. 2 of them have actually given us this scare too. Thankfully, it was not serious. Story 18. I went into serotonin shock after starting a new obsessive-compulsive disorder medication. I had no idea what was happening, and I couldn't make my body speak or call for help. In my brain, I was begging for emergency assistance and felt that this was how I would die. I can't say that I could see myself going through it again, but it felt like any stereotypical depiction of heroin withdrawal or overdose, or maybe both together. I probably looked like one of those videos of women you see flailing around on the ground high on drugs. I was finally able to stand and function well enough a full week later to tell someone about it, but no one I knew was aware of it either. So I waited for my 6-week checkup with my primary doctor before telling her what happened because, of course, I didn't want to bother her, and I took the medication the whole time. She was mortified, and by that time my psychiatrist was afraid taking me off the medication would make it happen again. Since I wasn't currently experiencing any major side effects, they let me continue the treatment. That was about 3 years ago. For what it is worth, the medication is life-changing, and I still take it daily. Story 19. Had a severe vertigo attack that lasted 2 full weeks. I was sweating profusely and dry heaving after vomiting. I was able to feed myself with squeezed packets of baby food and crawled on the floor to the toilet. I experienced 2 loud frequencies of ringing in my ear, and the worst was when the signals crossed. At the end of 2 weeks, I was deaf in that ear, and the nerve was dead. During the 2 weeks, I had no sleep and did not know what reality was. Story 20. Pregnancy hyperemesis caused me to be unable to eat for months, leaving me so weak that I could not walk or do anything. The moment she was born, everything disappeared. I regained my strength and appetite as if it had never happened. It was remarkable. Story 21. I got complications from chemotherapy treatment for Hodgkin's lymphoma. I was within a few hours of death before I was pulled back. I put complications in quotations because the doctors still do not know what it was or why it happened. All I knew was that my heart rate was 178 while lying down, my oxygen level was dipping below 80%, and I had a rolling fever of 104 degrees. They could not provide me with oxygen due to one of the chemotherapy drugs, bleomycin. There is no feeling on this earth as doom-like as being oxygen-hungry for an extended period of time. I would not wish that feeling on my worst enemy. In any case, I got really close. One day after a week in the intensive care unit, I knew it was my last day. The doctors were out of ideas. They had tried antibiotics, antifungals, and antivirals. They really took the kitchen sink approach, heart stress tests, and esophageal echocardiogram. You name it, nothing was working. When you get that close, you can feel it. For me, at least, death became like a physical presence in the room with me. I'm not sure I can quite describe the feeling. I did not want to go because I had a wife and 2 kids, and I begged the universe to let me stay. Call it praying or whatever you want. I am not religious. It felt like it would be the easiest thing in the world to just let go, to give in. Maybe it was the fever, but it felt like I was being called home. Like I was about to become part of something infinitely bigger than myself again, back to where I came from. I was not scared of it, and I do not think that at that point it would be scary. It just is. Feels inviting. I think you just let go and go. That was 5 years ago this month, so clearly I got better. Later that last day, after some begging on my part, and after seeing a post from someone with similar symptoms, the doctors gave me a really strong dose of steroids that they had sworn would not do anything, and it worked. My oncologist told me later that he saw me slipping away. They did not know what else to do, so they tried it. They still do not know why it worked or what happened. But thankfully, I am still here and about to hit my cure date in a couple of months. Story 22. I got heat stroke at work and didn't know what was wrong. I tried to drive myself home, half conscious, shaking uncontrollably, and vomiting out of my car door on the side of the highway. I called my husband for help, but he did not care. My mom picked me up, took me home, and watched over me since I refused to go to the hospital. I divorced my husband. Story 23. Tonsillitis. One thing people do not talk about with tonsillitis is that it can actually become dangerous. It is extremely rare, according to a doctor. Every year, like clockwork, between November and January, I always seem to get tonsillitis, which lasts 3 to 4 weeks and usually leaves me bedridden, taking a combination of medication just to get through it. One year, however, I was unable to sleep and found myself having a heavy continuous dry cough and struggling to breathe in the kitchen at 4 in the morning. I tried to drink something only to be unable to swallow it and barely keep it in my mouth. If my family had not found me, I probably would have a neck scar now. By 6 in the morning, I was rushed to the hospital, sitting up with my head leaning into a bowl because I could not even swallow saliva build up in my mouth, which was making the choking worse. My tonsils turned out to be so swollen with bursting pus spots that they were severely restricting my breathing. While having my throat checked, I actually heard, "Oh my God, I cannot even see your throat." I was immediately put on very strong antibiotics. They told me if the swelling did not go down in the next few hours, they would need to open my throat to help me breathe. Thankfully, after a few hours, I could breathe a little better and swallow a little. At one point, I was throwing up, which caused more pus to leak through. Somehow, even after all that, I was still turned down for tonsil removal. The requirement is pretty much having tonsillitis multiple times a year. After what I went through, I feel I should have received that surgery. Ever since then, whenever tonsillitis flares up, I immediately demand antibiotics and become too scared to sleep for the next month or so. Story 24. I had a miscarriage. I didn't know I was pregnant. It was very early, and my period was not even late. I suddenly felt very sick. My stomach hurt badly, and I threw up everything I had. I couldn't eat or drink without vomiting. I became dehydrated, could not walk, and could barely talk. I felt awful. I was alone with my 3-year-old who was sleeping. I called emergency services, but they told me to endure it, saying it was probably just a stomach virus. My husband was 3 hours away, and no family was available. He rushed to help, but there was not much he could do. I truly felt like I was going to die. I passed out a few times, then suddenly it all stopped, just like that. I went from feeling horrible to full of energy. I went to the hospital. They ran a few tests and found out I had been pregnant and was miscarrying. I guess my body just did not want that baby. Story 25, had an eating disorder, bulimia, and was severely underweight in my late teens. I had to have my heart and blood monitored regularly, or I would have needed a feeding tube. I slept for over 12 hours daily and could not physically digest anything without wanting to expel it immediately. I recovered over the course of several years, and I am thankful I did not experience an esophagus rupture, heart attack, or lose any teeth. Medical expenses and health concerns may still arise, but I am grateful to experience each day. Story 26. 10 years ago, I picked up a random chest infection that started as a bad cough but developed into a postnasal drip. This caused my sinuses to regularly drip mucus down the back of my throat into my lungs. While the mucus was in my lungs, it would dry out a little and eventually I would cough it up. However, it had the consistency of glue and would immediately block my throat, causing me to choke. I would then have to retch, hoping to clear my throat before I choked to death. Could take a couple of minutes to clear my throat. During this time, I didn't know if I would survive as my vision started to dim and I slowly lost consciousness. This happened every few hours for a week. The worst part was that it happened while I was asleep. I would suddenly wake up already choking, with my lungs only partially filled with air, so I could never be sure my body had enough air pressure to clear my throat. I was so afraid of it happening that I went without sleep for 3 days, but eventually, I knew I could no longer keep myself awake. I lived alone, and no one was nearby to look after me, so I put out extra helpings of cat food and water because I knew it might be a few days before someone discovered my body. I drifted off to sleep knowing I would soon wake up again with a blocked throat. Luckily, I was eventually able to fight off the infection, and the postnasal drip stopped. It was the worst thing that ever happened to me. Story 27. Probably kidney stones and appendicitis. Kidney stones caused the most pain I have ever experienced. I passed out several times. Appendicitis occurred because I did not listen to my body and brushed it off, thinking I would be fine. No, it required emergency surgery. The appendix was gangrenous and ready to burst. I dodged a bullet there but was still careless. Story 28. I got malaria in Kenya. I also had imposter syndrome about my job at the time, so I did not tell any of the doctors how bad it was. I just stayed in my room and did not come out for a few days. I have never sweat completely through a mattress before or since, with droplets hitting the floor from the underside and a puddle forming. It was the only time in my adult life I have ever felt a fever truly break. In a matter of seconds, I went from the sickest I have ever been to feeling completely fine, just a bit thirsty. It was very odd after days of boiling and freezing in my own skin. Story 29. My appendix died, got infected, and burst, leaking pus throughout my insides when I was about 15 years old. My mother dismissed me as being a hypochondriac and blamed it on me sneaking vodka cruisers that week when we were on holidays in a rural area. Then she blamed it on gastroenteritis from some dodgy food I might have eaten. After vomiting for 4 days straight, one morning she woke up to me screaming in pain. My skin was completely gray. My stomach had a noticeable yellow bloat pushing out from the inside, and I physically couldn't move or talk. I had gone into sepsis. I kept going in and out of consciousness. She panicked and took me to the hospital, which was 45 minutes away. It was apparently the worst condition the doctors had ever seen, and they did not have a surgeon capable of operating on it. I was so sure I was going to die that day. The look on the doctors' and nurses' faces said it all. Child services were also called as my appendix showed signs of dying and being infected for up to 2 weeks. They airlifted me to another hospital, another hour away, and finally operated. The pus had spread everywhere, so they opened me up extensively to wash it all out. I have a pretty cool scar. I got to see a photo of it, but sadly the doctors incinerated it before I woke up, so I couldn't keep it in a preservation jar. Story 30, herpangina. For almost 2 weeks, everything going down the throat, food, water, saliva, felt like swallowing broken glass. I lived on incredibly small amounts of water in a feverish state, waiting for it to end. Story 31, eating disorder. Waking up in a hospital and being told I could not leave, could not go to the bathroom without being watched, and could not even walk without a wheelchair was the scariest thing I have ever experienced. It is quite disheartening to be told at 15 that your body might give up at any moment, especially when the alternative eating scared me more than death. I would not wish that on anyone. Story 32. I once had food poisoning so bad that I thought I was going to die. I had a blinding migraine and was vomiting. Felt like razor blades in my stomach. I ended up on the floor sobbing because I was in so much pain and begging for it to end. I woke up in the morning completely fine. Story 33. I was fairly new at receiving very strong chemotherapy for an aggressive cancer. I lost all my hair just hours after the first treatment. I overheard a young nurse say that some patients just vomit until it passes, like the flu, rather than taking pills for nausea. That was wrong. I vomited every couple of hours for almost 4 days without any food. I was afraid I would die and then afraid I wouldn't. I couldn't lift my arms or walk. I was taken to the emergency room and given every intravenous fluid available. Took 5 hours, but after that I could at least stand up. Cancer is very difficult. This was 5 years ago. I am cancer-free now. Thank you, science. Story 34. Had pleurisy in my left lung around age 25. I couldn't take more than a tiny breath, and it hurt severely. Felt like being stabbed in the chest. I could hardly sleep or lie down. It lasted a couple of weeks, and I had to work through it because I had no insurance. 0 out of 10 would not recommend. Story 35. I lost my mind after taking multiple drugs. I had an out-of-body experience where I felt very wet, as if I was coming out of an incubation tank. Then I wanted to lie down on my bed, but my mind manifested my friend who guided me back to my body. In hindsight, I feel like if I had lied down, that would have been the end. Eventually, I came back into my body and was stuck in a loop of going to the kitchen and my room. It was a genuinely terrifying experience. Story 36. As a child, I was prone to getting very high fevers at least once a year. The fever was so high that I started hallucinating and nearly died. My highest recorded temperature was 42.4 degrees Celsius or 108.32 degrees Fahrenheit. Story 37. Before I got pregnant, I had never experienced heartburn, but I knew it was common during pregnancy. The further along I got, the worse and more frequent it became until the night I was 32 weeks pregnant and woke up at 4 a.m. feeling so sick and in so much pain that I couldn't walk. My husband called an ambulance. It turned out that what I thought was heartburn was actually gallbladder attacks, and ignoring them long enough led to pancreatitis as well. They stabilized me within about 18 hours after determining which tests and medications were safe for a pregnant woman. Then, 2 days after arriving at the hospital, I developed a pulmonary embolism in my right lung, and my condition became critical. There were no intensive care unit wards for pregnant patients, so they created one for me. I was heavily medicated, they couldn't reduce my fever, and they administered steroid shots to help develop the baby's lungs faster in case early delivery was necessary. I truly believed I would not survive to see my baby. Then my condition suddenly improved, and I was able to continue to my due date on a special diet and constant blood thinners. Even now, 24 years later, I still have nightmares about it. Story 38. I had infected bursitis in my elbow. It swelled up to nearly 5 times its normal size. I was just 19 years old and have never experienced pain and fever like that since. I am now 36. I would not wish it on my worst enemies. Story 39. When I was younger, I used to get very severe tonsillitis. I would have to get penicillin injections and had been sent to the hospital for intravenous antibiotics multiple times because my throat would almost close up completely. One time, when I was 19 or 20, I got tonsillitis again. About a week later, I was getting worse. I also had a cough and it hurt to breathe. I had developed pneumonia. I had very high fevers, felt like I couldn't breathe, and it hurt to cough because of my tonsillitis, but I had to cough constantly. It was like choking on nothing when I coughed. I felt like I was going to stop breathing, and that was going to be the end of me. I ended up in hospital overnight for the first time so they could give me a large amount of antibiotics for 24 hours. It helped a lot, but I was still very sick for a long time after that. I was this 19 or 20-year-old crying for her mother because it just hurt to be alive. I was so scared, and I didn't know what was wrong. Story 40. Anaphylactic reaction. I knew I was dying because I felt my body shutting down. I got tunnel vision and thought, this is it. It was a strange feeling at 12 years old. I had to be revived twice and transported by helicopter to different hospitals. I was hospitalized for over a week afterward. I couldn't believe how weak my body was after discharge. Story 41. Oh, right now, I am currently recovering in the hospital with kidney failure. I feel as close to death as I have ever felt. Story 42. I got a severe case of salmonella poisoning from chicken salad at a bagel shop. I was going back and forth from my bed to the bathroom for a week and a half. With no sick leave from my job, I willed myself out of bed and into my car to get back to work. I collapsed in the parking lot, was airlifted to the hospital, and received intravenous fluids as I was severely dehydrated. That was about 15 years ago, and I haven't eaten chicken salad since. Story 43. I had twins in 2019, no cesarean for context. About 4 or 5 days postpartum, I developed a horrible ache in my lower mid-back area on either side of my spine. I had no clue what it was, but it hurt intensely. Around day 6, muscle spasms started in my back, so anytime I tried to lie down or move too much, my entire back seized up. 1 week postpartum, I went to the emergency room. The doctor barely examined me. No lab tests were done, prescribed a muscle relaxer, and discharged me. The next day, day 8, I had a follow-up appointment with my obstetrician. Not only was she furious about the emergency room visit the previous day, but she also gave me a shot of antibiotics in the office before my urine test results came back, because it was obvious I had a severe kidney infection in both kidneys. She sent me home with a prescription for a strong antibiotic and a prescription for pain medication because I was in extreme pain. I took the pain medication exactly as prescribed because I am the daughter of 2 addicts and had abused over-the-counter medications in the past. I still couldn't lie down, so I was sleeping in the recliner in the living room. I had to be extremely cautious with how I moved or else my back would cramp painfully because the muscle relaxer did not provide any relief. I basically lived in the recliner and had my babies handed to me because bending over was impossible. Water began to taste horrid by this point, and I could barely drink it, even with a large amount of flavored powder. My body refused fluids. On day 9, I started developing a cough. My best friend came to visit and spent the night to keep me company. Day 10, I woke up at 7 a.m. and could barely breathe. I had almost no lung capacity, just tiny little pants. I was reluctant to see a doctor again after the emergency room, but she urged me to go. So I called and made an appointment with the first doctor who had an opening at 8 a.m. That doctor literally saved my life. It took her about 30 seconds to see that something was very, very wrong. She said she would do an X-ray, then examine me as best as possible without causing pain, listen to my lungs trying to function but failing, then stepped out to call my obstetrician. When she returned, she told me I was being admitted to the hospital and they would do the X-ray and a CT scan there. She let me drive myself to the hospital since I had driven myself to the clinic. My obstetrician arranged for me to be readmitted to the maternity ward because she could monitor me more closely there. Once I was admitted, 4 nurses came into the room to set me up and rushed me to CT, where I was moved to the front of the line, apparently ahead of someone involved in a car accident. They initially suspected a pulmonary embolism, but it was pulmonary edema. It was clearly connected to the kidney infection, but I'm not sure how. Presumably, my kidneys were in worse condition than I realized, and the excess fluid had to accumulate elsewhere. If you have ever seen a spirometer, I could not even reach 500 milliliters. I managed to get it to the first mark, about 250 to 300 milliliters, while a healthy person can easily reach 3,000 milliliters. I was told later that if I had not sought treatment, I would have died in my sleep that night, at the latest, from drowning in my own lungs while sitting upright. I was hospitalized for 3 nights on an intravenous drip of saline, antibiotics, diuretics, and pain medication. After discharge, it took me a month before I could lie down and 2 months to fully recover from the lingering pneumonia. If anyone has any idea why or how things escalated this way, please let me know. I am still curious. Story 44. The first time I had kidney stones, the pain was so intense that I truly thought I had an undiagnosed tumor that burst and I only had moments left. It was the only time I cried and begged for pain medication. That was quite an experience. Story 45. When I was 28, I had a fever of over 106 degrees Fahrenheit. I went unconscious and had seizures. They had to keep me in an ice bath for a long time. I woke up 3 days later with retrograde amnesia. I couldn't remember anything after high school. It took about 2 weeks for my memories to really start coming back completely. It was pretty frightening until then. I had to put a lot of trust in my girlfriend, who had just moved in with me a couple of months earlier, but I couldn't remember anything about her. She was very patient and kind. Then, a week after I recovered, she cheated on me with her boss and a random 19-year-old in the same week, subsequently giving me chlamydia. She became my ex-girlfriend when she confessed as she gave me the antibiotics and explained what they were for. Life is. It just is. Story 46. I fell and suffered a brain bleed, which left me stuck on my floor for 30 hours before medical intervention. During that time, I developed an infection that entered my bloodstream, causing sepsis. The stay in the intensive care unit was very traumatizing for many reasons, but I know I was very lucky. Story 47. I had coronavirus for around 70 days, and at one point it gave me bronchitis while I had the coronavirus. I was coughing for around 5 minutes and gasping for air in between, which scared me a lot. However, to be honest, I don't think I would have died looking back on it now. Story 48. Meningitis. I was feeling like I had a bit of flu or a cold in the morning, but nothing serious. I had to go to school to write 2 exams that day. During the first, I started getting a severe headache, so I just lay on the floor during the break. I finished my second exam within an hour and was feeling fine but passed out at my desk for the next 2 hours. When the invigilator had to shake me to get my paper, they realized something was wrong. My mother picked me up, and by the time we got to the hospital, I could barely walk. I had to wait about an hour before I saw a doctor, and by that time, I couldn't open my eyes because the light caused extreme pain in my head. The doctor saw me for about 5 minutes and immediately knew what was wrong. I was admitted right away. By this time, I couldn't walk and was experiencing a strange type of synesthesia, which I don't normally have. The doctor immediately prescribed the correct medication. I can't remember if it was viral or bacterial, but luckily they didn't have to perform a lumbar puncture. The strange thing is, I felt okay by the next morning while on the medication. I was in the hospital for 4 days, but they told me I had to quarantine at home. I missed half of my final exams while playing PlayStation and taking a large amount of medication. My parents were convinced I might end up in a coma or die because I was starting to say extremely strange things. I remember thinking, this is it, when I couldn't walk or open my eyes. I am very grateful that the doctor diagnosed me correctly so quickly. After reading more, I believe I had a bacterial infection because I am from sub-Saharan Africa and it occurred in late November or early December. I did not know about the meningitis belt before. Story 49. My parents left me in a hot car when I was very young, and I can barely remember the hospital visits that followed. To this day, I can hardly tolerate hot weather in general. Story 50. Not to be that guy, but my mental health at its lowest was horrendous. Rock bottom kept getting deeper. From the ages of 11 and a half to 18, I thought of suicide every single day. The depression caused anxiety, then the anxiety planted paranoia, which reached an insane level. Quite literally, the stress gave me tics and I couldn't even eat, sleep, or drink sometimes. I have attempted upwards of 7 times. Planning and being very close is not included. Otherwise, we would be in the 10s and maybe 20s. On top of all that, I was 16 when it was pointed out I definitely have attention deficit hyperactivity disorder and 17 when people started telling me I showed signs of autism. Genuinely, I don't know how I didn't die from at least some of the attempts. Some were understandable, but there are some that bewilder me. I also don't know how I didn't get a severe infection from self-harm. That bewilders me still. I am going to be 21 in 2 months. Life has been cruel in many ways, but the joy I feel when I get to do the things I love and doing things in a manner that is unusual to some but makes sense to me. 15-year-old me wouldn't recognize me. 17-year-old me wanted so badly to be who I am now, minus a lot of trauma. I am really happy I am here, Plus, now I get to joke about it and I cope in cool ways often. Life is a roller coaster, but I am learning how to hold on. Story 51. I found out the hard way that I cannot take Maxilin or Stemetil. I go into oculogeric crisis. I seriously thought I was going to die. The back of my head was almost touching my shoulder blades, and I was having trouble breathing. A few shots of hydrocortisone fixed it, but I will never forget the look of fear in the eyes of the young doctor in the emergency department. She was terrified. I can say she had the loveliest green eyes I have ever seen. The senior registrar was saying to her, "You know what this is. What do you have to do?" I was lying there thinking, just tell her. Story 52. I had appendicitis, and my mother was a recently divorced single mother working full-time. She kept telling me to take a warm bath because that always helped her feel better when she was in pain. It got to the point where I could not move, and we got a police escort from the local emergency room to the nearest hospital that could operate on a child. It was about a 2-hour drive, and they said I would have been dead the next day if I had not gone in. Story 53. Septic arthritis. I could not move my arm. I needed gas and air to put it in a sling. I had been sent by my general practitioner 2 weeks earlier when symptoms started. The hospital registrar dismissed me, saying it was nothing. After 2 surgeries to clean the infection out of my shoulder, I am now awaiting a shoulder replacement because my joint has been destroyed. If I ever see that registrar again. Story 54. Many years ago, I had a pregnancy that went septic at 23 weeks because of bacteria that normally causes meningitis. I had to be induced and give birth while having septic shock. My blood pressure was so low they feared they would have to amputate my foot. My baby lived for a few painful minutes after birth, but we both would have died if I had not been able to decide to induce the birth. This is why access to abortion is important. It saves lives. My other daughter would have lost her mother as a toddler. Story 55. I had subacute bacterial endocarditis combined with a faulty heart valve, unknown to me or any doctor I had seen before. It was initially misdiagnosed as streptococcal pharyngitis. The first doctor I visited performed a quick throat swab test that came back positive for streptococcus. Since my body was colonized with streptococcus, it naturally tested positive. I lived with endocarditis for about a month and a half. I can try to describe how cold I was daily, but words cannot fully convey my experience. At one point, I wore 4 jackets, 3 sweatpants, a beanie, and gloves, and I was still freezing. My hands and feet felt like icicles, and all my fingernails turned blue from lack of oxygen. It was worse at night. My body temperature would spike to 104 degrees Fahrenheit. In the middle of winter, I would wake up soaked in sweat down to the mattress through protective padding, overheating due to massive fevers. My house was 56 degrees Fahrenheit at night, and I had to lie on the tile floor in my underwear for over an hour to cool down. I had severe headaches and was always thirsty, no matter how much water I drank. My vision was impaired. I experienced unusual kaleidoscope-like scans across one or both eyes. Imagine the scanning light of a copying machine, but rainbow-colored, moving across my field of vision for over 30 minutes. When I was admitted to the hospital, after one doctor finally diagnosed my illness following 3 urgent care visits, my water intake was restricted to less than a quarter to half a liter per day. Over 5 days, I had blood drawn every few hours with fresh needle pokes each time. I must have been poked over 24 times. I remember undergoing a transesophageal echocardiogram because the nasal line for sedation was partially dislodged shortly after the procedure began. After discharge, I had to undergo intravenous antibiotic therapy via a peripherally inserted central catheter line to clear the endocarditis before open heart surgery to repair my heart valve. I received intravenous antibiotics twice daily for 45 days, self-administered through the catheter line. Saline flushes were strange because although injecting salt water, I somehow tasted seawater. After clearance by an infectious disease specialist, I secured open-heart surgery at Cedars with Dr. Alfredo Trento, an excellent and compassionate surgeon considered among the best in the world. Between being cleared and surgery, I felt extremely unwell. I doubted I would make it to the operating table. My heart struggled so much that it enlarged to the medical safety limit. I would wake gasping for air in the middle of the night, with my heart beating over 100 beats per minute at irregular intervals, alternating between two strong and two weak pulses. The waiting was the worst part, not knowing if I would make it in time for surgery or if I would wake up afterward. Long story short, my heart was repaired, and I am healthier than ever. Living with a fully functioning heart is wonderful. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.